Hi, my name is Maggie. If you click on the topic you have questions on, I would be pleased to answer you. Total knee replacements and anterior cruciate reconstructions done the traditional way are prone to human error, which can cause inaccuracy. This can occur in as many as 33% of all procedures. The inaccuracy rate for the Bluespot knee replacements is less than 0.5%. The computer does not do the surgery. The computer uses infrared light to determine the dimensions of the knee. It then calculates where the cuts should be made. Mr. Sampath himself then makes the cuts. The computer then checks the cuts after he has made them. If anything has to be changed, Mr. Sampath can then make modifications to make it right. Yes, Mr. Sampath always does the surgery himself. He has a special team that assists him during the operation. The operation itself takes about 50 minutes surgical time. The total time in the operating theatre also includes the time to and from theatre, the anaesthetic time and the recovery time, so the patient can expect to be off the ward for about 3 hours. You can have a shower 5 days after the operation, provided the wound is kept covered. You can have a bath as soon as the clips are out and the wound is fully healed. This is usually 10 days after the operation. You can go swimming as soon as the clips are out and the wound is fully healed. The skin is always numb on the lateral side of the midline incision. This is because tiny nerves in the skin are always cut while making the incision. This improves a little over time, but never goes away completely. Typically, patients will walk the next day. They can climb stairs on the day of discharge, which is usually day 4 after the operation. Patients are usually able to drive 8 weeks after a right total knee replacement and 6 weeks after a left total knee replacement. The physiotherapy is individualized to each patient. Patients use 2 crutches on discharge. They gradually progress to using 2 sticks, then 1 stick. Typically, patients need physiotherapy for a month and then continue with their exercises at home. Patients say that the knee feels right at about 3 months after the surgery. Patients can usually play 9 holes after about 12 weeks and can manage 18 holes after about 20 weeks. In very fit patients, both knees can be replaced under the same anaesthetic. Usually, however, the second side is done about 4 weeks after the first side. Surgeons who wish to view this procedure are welcome to apply for a place as an observer only at the Bluespot Knee Clinic. Permission would first have to be obtained on an individual basis from the patient who is having the operation. This is done by Mr. Sampath. Mr. Sampath is a recognized international instructor in computer-aided knee surgery and regularly trains groups of surgeons at approved courses in Germany.